Hello and welcome back to Strategic Outsourcing. Today we're going to get real. We're going to use real-world examples and apply that to incident and problem management to discover how we can generate value for the business. Today's learning objective is straight to the point, using the ITIL tool sets of incident, problem, and request management to create value for the business. There are, however, a number of prerequisites. You would have already gone through the training in 101 and 102 as well as completed the exercises. Next, we also expect that you already have an ITIL background, and if not, please go through the training videos provided in our website for incident, problem, and request management. Before we begin, let's do a quick recap. Value can be generated from both risk mitigation as well as business benefits. The important concept about value is that there is a time horizon. There are certain things which can immediately impact. However, there are also certain fixes that has a longer term value horizon. And the next recap, you will need to quickly go through how do we identify where are the biggest value drivers, and begin with the customers that provide 80% of the overall cash flow to the business. And as you follow the value chain, you'll be able to identify the business units that supports those customers and identify the business unit that returns 80% of the effort required to keep the customers happy. And from the business unit, you will know through the accounts receivable what is the dollar amount that this unit generate, and from the accounts payable how much it need to pay the suppliers for the raw materials or the parts that's required for the job. Thirdly, you may also need to look at the borrowings that is required for the business unit to do the work. Alright, now let us focus more on the business unit at hand, which is, for the purpose of argument, Unit 2. And we're going to use a real-world example of a hospital. A hospital consists of many business functions, and one of them is outpatient treatment. The key to success is volume and high quality of services. This comes in the form of low wait times and being able to attend as much patients as possible throughout the day. Next, we're going to examine really quickly the smaller activities that make up an outpatient treatment business process. Usually the customer will need to take a queue number, and from the queue number, he'll wait, and once it's called, there will be a registration process. And the two systems involved here are a queuing system and a medical records registration system. I am emphasizing on the IT systems because these are the ones that will have impact on incident management as well as problem management. After registration, once the names have been called, the patients will then undergo the diagnosis activities, where the doctors will quickly look through again the same medical records for any prevailing sickness that the patient may have, because a patient that has diabetes would have a slightly different regimen. The three systems that tend to be involved here, besides the medical record system, is, for example, PACS, Picture Archiving and Comm System, as well as medical supplies and inventory. Why is that? Outpatient treatments can also consist of accidents where there could be a bone fracture and therefore requiring x-rays. And during the diagnosis period, the patients could also be bleeding, therefore requiring bandages and salves, cotton swabs to stop the bleeding, and therefore medical supplies are being used. The purpose of a PACS system is being able to digitize the manual scans and then shuttle it to the whichever unit within the hospital that needs to take references or look back at how the patient history is. Now, after diagnosis, the doctors have gathered sufficient information, he will then prescribe treatment. And the same medical record system will capture the treatment that the doctor has recommended. In the treatment space for larger hospitals, the same doctor that is doing the diagnosis may not be the same medical practitioner treating the customer. We will get to the billing, where point of sale system is very important because the patient could also be using credit cards, and the cash register. So this will need to be captured and linked back to the hospital's ERP finance system. Finally, the patient will need to go to the pharmacy where he will collect the drugs or medication that's required on top of any other extra medical supplies, like more bandages, for example. So how do we link it to ITIL? Incident management shows immense value when the IT outsourcer is able to anticipate seasonality. This is a skill that every IT outsourcer needs to have. Analyzing your incident management reports knowing when peak periods are, within a day in a week, within a week in a month, and within a month in a year. And when you're able to analyze peak period, you'll be able to preempt and prepare your IT systems for failure. Because at peak periods, failures cost a lot of money to the business. You need to manage customer expectations by linking it to value. You calculate it through knowing exactly the critical path of that business function. Now, over here is queuing medical records for registration, diagnosis, and the treatment. Because for big hospitals, when the medical record system goes down, then the treatment side of the hospital will not know what to do. And there'll be a lot of slowdown in the entire process. And what are those value parameters that we're looking for? Average revenue per outpatient customer, maximum number of patients per day or total patient per year, and duration of patient wait time from queuing to collection. Okay, now to the real world examples. What are the data that needs to be collected? First, we need to know the total cash income generated from outpatient treatments for the year. Let's take 1.2 million ringgit. And the total number of patients per year from last year's record is about 10,000 patients. But that is not as important as the highest number of patients that can be attended by the hospital. Let's take 1,000 patients in a month. That's maximum. So that means the upper limit of the hospital is 12,000 patients per year. And the hospital is open 10 hours in a day, 365 days in a year. When you take 1.2 million ringgit divided by the maximum number of patients that can be attended, you get 100 ringgit per patient. That's roughly an average value of an outpatient customer. We want to know what is the maximum amount that can be attended to. And from the calculation, we can see that the maximum amount of patients that can be attended per day is about 32 patients. Since we already know that it is only open 10 hours a day, it means that 10 hours divided by 32 patients results in 18 minutes or 45 seconds of patient time from start to end of the outpatient business process. Whenever any IT system goes down, which slows down the critical path of the business process, exceeding 18 minutes 45 seconds, 100 ringgit will be lost. We could have prevented this failure of 100 ringgit every 18 minutes and 45 seconds if we have a fast enough workaround. And therefore, these are some of the ideas that you can do as a preventive measure to generate value for the customer. Example 1, can the queuing system be done manually? Can we supply some sort of paper system in the event the IT system goes down? Can we have prizes be made available at a point of sale system so that the customer doesn't need to wait indefinitely while the administrative staff figure out how much does the treatment should cost? And another example would be, can even the IT system itself be updated where the receipt contains the medication and the measures that needs to be provided to the pharmacist so that drugs can also be issued in the event the pharmacy system goes down. Importantly, whenever any of this workaround is provided, the manual and training needs to be made available to the hospital staff so that their expectations are also managed. Alright, now we go on to problem management. I'm going to give you elements that make up a good problem management solution. Remember, every incident that is beyond 80 minutes is about 100 ringgit. It needs to increase accuracy and reduce data entry mistakes. A good problem management solution also will be able to detect symptoms of potential incidents very early on. For example, if suddenly your incident shows a number of customers complaining about slowdown of the IT system, that's usually a sign that it's about to fail and we need to do preventive actions immediately. 4, it directly impacts key performance indexes of business process owners. So we identify that by knowing which are the stakeholders that will be blamed whenever this process goes down, and also who will be rewarded when there's performance improvement. In the example that I provided here, you need to be able to identify who is the key champion, accountable personnel for outpatient treatment process in the hospital. 5, the cost of the permanent solution should be less than the monetary value of the problem. It doesn't make sense to put in a solution that costs 1 million ringgit to solve a 100,000 ringgit problem. 6, every permanent solution should be recorded because, in fact, every single thing that the IT outsourcer do for the customer should be recorded because effort is money. And if you're ever unsure about how you want to go about this, or if you have an idea but you don't know the cost, the licensing, all that, please feel free to contact your pre-sales team, because this is where we will get all the rest of the solution components within Merciniaga to work on this problem, because this is an opportunity. The next section we're going to go through is how do we calculate value through request management. The thing about request management is it is low value because it's effort-based, 1. 2, it is more pertinent to the IT outsourcer versus the customer. In this example, we're going to take a simple scope where the customer requires 5 personnel to be on site for one shift to attend to 1,000 incidents per month. On top of it, it also covers desktop services where the IT outsourcer needs to go to the customer's cubicle and fix whatever problem that they face there, to provide reporting on the root cause and the incidents on a monthly basis. So what are the parameters that need to be gathered in order for us to know the value back to the business? A, as you can see below, the value of the contract is 300,000 per year, and as such, the total value of each incident is 300,000 divided by 1,000 incidents per month divided by 12, or 25 ringgit per incident for that year. And on average, about 10 incidents will be attended per personnel. Although the personnel is relatively free, being only requiring to attend to about 1 to 2 incidents in an hour, what we want to focus on is the value of being able to perform more incidents as well as requests for the customer, because we already have the value per incident based on the contract. So for anything more, let's say 100 more incidents in this example, the team would have produced 100 times 25 ringgit or 2,500 ringgit worth of value back to the customer. Next example, if the customer requests for a single individual to be on site for one whole shift on Saturday every 2 weeks, how do we calculate that? The value per personnel is about 300,000 divided by 12 divided by 20 man days, because this is only a standard Monday to Friday working shift. Divided by 5, you get 250 ringgit per man day per person. And in order to calculate the cost of that, it is 52 Saturdays in a year divided by 2, because it's only going to be there once every 2 weeks. Hence, 26 times 250 ringgit comes to RM 6,500 ringgit of extra value just to have one person on site on a Saturday. Again, it's something that we do not charge as value back to the customer. And this brings us to the end of the lesson. So we're going to quickly summarize what we have learned today. Firstly, incident management and problem management must be related to the business process and the value of the business process. Find out who's the key stakeholders in outpatient treatment, for example, and find out how much does it bring in terms of cash flow for the hospital. And then request management is effort-based, but it doesn't mean that we shouldn't tie this back to the value of the business. Let's say request management is a improvement request, and you have managed to serve more than the allotted 12,000 patients within the year. Immediately that translates to dollar value per patient that you managed to bring into the hospital. Third, anticipating seasonality shows the customer that you're thinking on their behalf. It shows maturity. It shows that you know how to think ahead. Fourth, problem management should not only solve problem but generate even more value to the customer. Don't just think about a permanent solution that is fancy but doesn't really bring substantial impact to the customer. Lastly, I have to reiterate again, effort expended to the customer is value. You can calculate it. So thank you very much. Now we go to the exercise phase. We have assumed that you have done exercise 1 and 2. Please complete it if you haven't done so. From your business, find the critical path of a key value generator, key cash flow generator, and then explain how risky that business process can be. Explain for every hour outage how much potential cash will be lost, and explain how the customers and suppliers will also be impacted. Explain how an incident manager or an agent can quickly address the situation through a workaround. Think about your known error databases. How do you make it rapidly available? What are the manual processes that needs to be in place, and how do you make it easily accessible? Next, explain what are the activities that can be done so that the customers can adapt to the failures of your IT system that's supporting your business. Because customers need to be aware that IT system is down. Doesn't mean that customers just go, too bad, system down, I'm not going to do any business with you. That's truly one of the worst experience that the customer can have. To go into a business and say, system is down, I'm sorry, I cannot do anything for you. Lastly, explain what are long-term plans, the problem management area here, in terms of process change or IT solutions that can be put in place in order to solve that problem that has a value. Remember the exercise that we just gone through. High impact, low cost. What are the permanent solutions that can generate the most amount of value back to business in terms of optimization, business benefit, as well as reduction of risk. I look forward to your exercise and do submit them to the forum, and good luck in the strategic IT outsourcing endeavors.